a marketing manager at HR Simple, and I will be moderating today. Today's webinar will be presented by Julie Pace and Heidi Nunn-Gilman from Gamage and Burnham. If you have any questions, please submit them in the chat box, and Julie and Heidi will answer them throughout the webinar. If you need to view more coronavirus webinars or view a recording of this webinar, you can go to hrsimple.com/events, and that is listed in the middle of the screen for you. HR Simple provides federal and state-specific manuals. They are written by top attorneys such as Julie and Heidi, our presenters today. They both author our Employment Verification Guide as well as the Arizona Human Resources Manual. All of our state-specific manuals have been updated with brand new chapters to help you during the pandemic. New chapters include shutdown policies, communicable diseases in the workplace, and the 6-day home poster. Today, you can use code RISKMANAGEMENT30 to receive 30% off any of our products for attending today's webinar. Now we're going to take some time and learn a little bit more about our presenters. Julie Pace's practice handles employment law, handbooks, drug and alcohol policies, I-9 and E-Verify compliance, OSHA, independent contractor and alleged misclassification issues, and government contracts. She regularly provides training to companies and assists with investigations. Heidi's practice focuses on employment litigation and human resource matters. She advises clients on matters relating to labor and employment law, including I-9 and immigration compliance strategies, E-Verify, ICE, and worksite enforcement. So at this time, I'm going to pass it over to our presenters so we can get started.
With HR Simple, who's out to help you be proactive and help you in your businesses and help you avoid problems at the government and avoid audits and be ready to go. So Heidi, on behalf of Heidi Nunn-Gilman and myself, Julie Pace, we've got a lot of things to cover, so we're going to go ahead and get started. So the first thing is we do have a quick disclaimer just reminding you that sometimes a specific fact can change everything. So please keep that in mind, that some of this is general advice, some of it you may be able to apply, but please double check. We work with everybody across the country too. We work with people in different regions, and you have lots of advisors, and you have those great manuals that HR Simple puts out. And in fact, we have just been updating all the pandemic items into the new books, so look for the new books and the rollout of those shortly. Okay, so just remember the disclaimer. Now, we always use the quote by President Truman: America was not built on fear. America was built on courage, on imagination, and an unbeatable determination to do the job at hand. Well, I think we all know what that means. We're all improvising, adopting, and overcoming on a regular basis. It has been quite the challenge for everybody. So, this is something that it changes. The rules are changing regularly. And right now we're trying to get everybody back to work, as we know. So, these are things that have been a little bit complicated. People are making more money on unemployment than working sometimes, so everybody's ready to hire and return to work and start phasing in, and we don't quite have everyone there yet. So anyway, but remember that ends the end of July, so you get a lot of people in coming to work and trying to apply, so you're going to be able to hire and probably pick more on skills, knowledge, experience, performance, and have opportunities to be able to hire people that can fit better. You can right-size your companies, and you can come back leaner, meaner, and more efficient and productive than before. For those who are in the restaurant and hospitality industry, everyone should support those in particular who've been harmed, the gyms, yoga studios, you name it, spas, as they have had a harder time in being shut down in most states, and we're not considered essential in a lot of states, so they need our support in helping them get back going again. Let's talk first on the Paycheck Payroll Protection Program basics. A lot of people got their PPP money. The salary for calculation was capped at $100,000, so make sure that you remember that. You also can include group health premiums and other similar costs. This is the time a lot of people got their money. Some people are still applying for their money. You've seen some controversy and some bankers who were concerned about what was being actually turned in on the application. So we're going to talk about all that. And this is designed to help you put people to work, to keep people employed, and to assist your company in these unprecedented times with the pandemic. That's a very unusual time period. It's a black swan of epic proportion. And we know that we are in a marathon, not a sprint. This is going to go on for about 18 months. So the monies are there to help companies succeed, keep businesses going, and to help ensure more employees on the payroll. You have to use them for eligible purposes, and employees have to be retained as long as you have 75% of the overall compensation and maintain certain requirements, which we'll talk about. You should be able to use those monies and possibly having them forgiven. At least 75% of the PPP loan funds must be used for payroll costs, subject to this requirement. PPP funds can be used for payroll, continuation health care benefits, paid sick, medical, family leave, insurance premiums, everything related to that. You know, you have HSAs, you have a number of things, employee benefits, 401k, things of that nature, profit sharing. Mortgage interest payments, but not mortgage prepayments or principal. It won't let you pay off your mortgage. Rent, utilities, and then any interest on loans that were incurred before February 15th, 2020. The payroll costs, as I mentioned, we did a list of these on this PowerPoint of salary, wages, commissions, tips, payment for vacation, PTO, sick leave, parental, family, medical, all those things. Severance payments are included. So if you right size or you separate because someone can't continue, could be even a COVID reason, and you decide to give them a settlement agreement and release, that could work. State and local taxes assessed on employee compensation and contributions to defined plans such as 401k, and those are not included in the $100,000 cap. So even, you know, we've had some advice to clients over the last 48 hours over this. They thought they had miscalculated. They were trying to figure out if they made a mistake, trying to figure out whether they should return some of these monies. And we found out that even though their salary was capped at $100,000, the actual benefit program was not. So that was some good information for some of those calculating those items. One observation to remember is payroll costs for your PPP program do not include compensation of an employee whose principal place of business or residence is outside the United States, such as a temporary visa holder. Compensation of an individual employee in excess of an annual salary of $100,000, which we mentioned, that's capped. It doesn't include federal employment taxes imposed or withheld between February 15th, 2020 and June 30th, 2020, or qualified sick and family leave wages for which a credit is allowed under the Family First Coronavirus Response Act, or FFCRA, as we call it. So keep in mind those. Now, what are those forgiveness requirements? Well, you must use 75% of the loan amount for payroll costs. The other 25% are for those other eligible expenses that we just broke down: rents, utilities, mortgage interest on a regular basis, no prepayment. If the total number of full-time equivalent employees is reduced in the 8 weeks following loan origination, then the loan forgiveness amount will be reduced pursuant to a formula also. So you need to make sure what your FTEs are during that 8-week time period, the date you received the funds, and the end of your 8 weeks. And that's going to matter when you're putting your documentation together. If the total salaries paid to employees are reduced by more than 25% following that loan origination, then the loan forgiveness amount will be reduced pursuant to a formula. The amount of the PPP monies you receive that is not forgiven will bear interest at 1% per year with a 2-year maturity. So just keep in mind, as long as you had good faith in getting your money and you signed your certification about you're certifying, especially there's a difference on a timeline if you received your money before April 23rd or after. So April 23rd is one of those time periods also on when you did your application, because after April 23rd, they added an extra requirement. But those before April 23rd, the sentence being certified was current economic uncertainty, makes this loan request necessary to support the ongoing operations of the applicant. And that's to make sure you're in business, you have your working capital, you can continue so that you have your companies and employees out there. Now, we are suggesting and recommending, we have a lot of recommendations at the end. You can pick and choose what you want or implement yourself or work with your advisors. But we recommend doing what I'm calling a substantiation memo with supporting documents while you're in the process of receiving, using, and allocating and auditing your own monies and segregating those monies and how to count for them. We think it's an important time to do it, and that this package that we've been putting together can be used to your accountant for tax returns for the year, your banker who's going to make the decisions on forgiveness, and if there's what's called a SIGPER audit. Many people will have those audits. It's called the Special Inspector General for Pandemic Recovery, SIGPER. They may audit the loans to see if you were truthful in getting the money. They have broad authority to pursue civil and criminal remedies. Everyone who has $2 million or more will be audited for sure. Others will also be. They are auditing the EIDL loans, and tax credits will be audited. Also, you have to watch affiliation rules regarding multiple companies or size issues, even if based on correct SIC codes. So we've had to disappoint some clients who really didn't understand those affiliation rules. Remember, there was a very compressed time period for people to turn in their application. Then more information has been coming out weekly and daily. And then they had to reevaluate, by May 14th, do we turn monies back in? And one of the memos we've been having to work on with people is affiliation rules for their company as to whether or not when they have multiple companies, even if they are standalone companies operating in different areas with their own EIN numbers, whether they can actually keep the money or must return it. So we had one this morning that was over $2 million, $2.7 million. They're going to have to return it. It's very disappointing, but that's what happened. All right, documentation. What does that mean then? It's good if you could do a segregated account for your PPP money, completely segregated, keep your records. The SIGPER can do audits for at least 5 years after you receive your money, and it is mandated that everyone over $2 million will be reviewed. The forgiveness request will include documents that verify the number of FTEs and how you paid it and your eligible expenses. And you must certify the documents are true and that it was you and that and the forgiveness amount was to use to keep employees and make eligible mortgage interest, rent, and utility payments. We suggest using a spreadsheet. And again, in our substantiation memo, if you're interested, we're making people put together all kinds of exhibits so we have like one complete package and position statement to hand off to people. We think that's a easier approach. You don't want to have to be backtracking these 2 years later to try to remember what you did in April of 2020. So keep a file of everything that you used, your application file. I know a lot of you did not get your applications from your bankers. They made you sign online. You need to get that and ask them for that and let them know. A lot of banks were pushing back and saying, well, you had to have done something at the time, or surely you have it. No, you don't, because you did it so quickly, you didn't get that. So you want all your communications with the lender. If they called you to encourage you to apply, if they said, here's the application, here's the interpretation, save all of it in that file. Also, consider this written memo, the substantiation memo. We think it's important as to why the loan was necessary. Looking at all the data of government shutdown orders should be in that file, the financial situation, any business that was lost, delayed, projected to be done that slowed down, any supply distribution interruption, any closures that impact the company, their company's supply chain, shouldn't say change there, supply chain, subcontractors or vendors, what layoffs or furloughs the company did conduct, or maybe you've reinstated by now, but however that played out, keeping a list of all those people you kept on that you wouldn't have if you didn't have this money, articles on the pandemic's impact on your specific industry and or your region. If you get rejections from suppliers that say, hey, we're not going to be in business, it's COVID-19 in our state, in Pennsylvania, so we can't send you stuff, save all of that. And other factors you consider when taking the loan. This is what we're putting into this substantiation memo with attachments. And you want to have your file be even broader than that to back it up for supporting documents. So when you're audited, it's a very simple process. Bank statements from the PPP account and any accounts which funds were transferred to, save all of that. Any documents to prove the number of full-time employees during those covered periods. Spreadsheet on how you calculated your FTE and your payroll records for that time period. So you want to keep all that together. I would also keep copies of your rental or lease agreement, copies of any utility bills, and showing proof of payment. Sometimes they'll send a follow-up that you got your payment. I would include that in there. Proof of mortgage interest or other business loan interest, and canceled checks, invoices, receipts, all those kind of things. Remember that the PPP is for 500 employees or less, 499 employees or less. So if you do your affiliation and find there's a problem, please look at that. 500 plus employees are not eligible unless you meet the SIC codes. There are some exceptions for accommodation and food services. Although those people in the accommodation and food services industry, the government needed to go further to help them get some exceptions because most of them couldn't have employees during this time period. So they can't meet the FTE requirement. So they're watching very closely whether they have to turn back all this money when actually that industry needs the money the most at this time to get their businesses reopened as there's phased reopening as we go forward. So keep that in mind. These are some of the codes to look at. Quickly, I want to talk about the EIDL, Economic Injury Disaster Loans. We've had people get up to $1 million on that, some 10,000 emergency grants. It is also based on SBA size standards. Many of the last funding round was 15,000 each. They're going to have some more funding possibly come out. And just remember that's being administered by the SBA. We also have the 500 and more CARES Act assistance to large employers. And what they get is on PowerPoint 18, the fully refundable federal tax credit for businesses, regardless of size, if your operations were suspended or if you have gross receipts, and it gives you the numbers, less than 50% of those for the same quarter. There's qualified wages, means up to $10,000 per employee, or maximum credit $5,000 per employee. For employees with over 100 employees, or companies with over 100, only wages paid to employees who are not currently working count. So keep that in mind. There's also the Exchange Stabilization Fund loan. So there are some really Main Street lending loans that you can get. If you have 500 to 10,000 employees, it's a 2% interest, 6 months of deferred payment. You do have to make, as a borrower, several certifications, but that you will restore 90% of your workforce after the pandemic ends. You're not a debtor in bankruptcy, and you'll remain neutral in union organizing efforts. So there are some very good Main Street lending programs right now that may be helpful to you. Wanted to mention the SIGPR audits, just to remind you, they will be monitoring fraud and abuse, and they can conduct audits. They can get depositions, subpoenas, all kinds of things to obtain documents and information. Businesses utilizing the CARES Act benefits should take proactive steps to minimize the risk. Ensure applications and representations are accurate, avoid fraud or integrity allegations. We've been doing a lot of cover letters this week for return of monies, or people who miscalculated or made some inadvertent errors, and they want to turn monies back because they don't want to have to loan or owe money. So we're doing those now. This is your time, you can do that. And of course, if you figure it out, you can do that. Implement control measures to track and document the dispersed funds. Make sure the company has an audit tracking feature to demonstrate to the government if there's an audit of the complete tracing of the monies, and establish a separate account to handle all transactions. Comply with your conditions. You may have a banker conditions plus the program conditions. And again, we're waiting right now on a new release we hear the Treasury is going to give on some factors to include on economic uncertainty. Obviously, these are unprecedented times. And in April, when you made those applications, it was highly difficult times to know what was going to happen and what's going to happen for the next 18 months. This will be a bit of a roller coaster with different phases in and out. So those are definitely difficult for companies. We recommend doing an updated business code of ethics policies and adopting procedures to attain compliance. We like to do that for companies who are handling government monies, whether you're a government contractor or now taking this type of a PPP money under the CARES Act for purposes of forgiveness. Develop internal accounting procedures. Don't ignore any SIGPR audit. Get help with that. Get counsel to keep it privileged and to deal with it. Unemployment compensation, I'll cover that really quick before I turn it over to Heidi. But remember that unemployment is the reason we're having a little bit of a difficult time in trying to get people back to work. In every state, they added $600 per week. They waived the first week, so they didn't have that deductible period, so they can get money from day one if it was related to the pandemic. If they have significantly reduced hours, they still are eligible for the money. And it won't count for private companies' experience ratings. Again, if you're a self-pay and have nonprofits, there may be some different rules there. But generally, it does add on to the amount of unemployment they would normally get. And one of the things it did is it didn't require people to actually look for work. But the other guidance that just came out, because everyone's realizing in the government it's a problem, and a lot of people are staying at home, taking this money and not returning to work when there's jobs available. The government has said if you write a letter and you let people know that you have a job available and they're welcome to return and they choose not to, you keep that into your documentation file, and that will not count against you for your 75% numbers. So pay close attention to that one. All right, Heidi, I'm going to let you take over for a little bit. So why don't you start going through some of the best practices and some ideas on the employment.
Okay, thank you, Julie. It's kind of funny maybe to have a slide on the symptoms of COVID-19. We're, 4 months, 5 months into this, and feel like we probably should understand it by now, but CDC keeps changing their guidance. It was changed 2 weeks ago, and I went on last night, and it's different even than it was a week ago. So they still say that symptoms are believed to appear between 2 and 14 days after exposure. 2 to 5 is most common. The severity of the symptoms may vary, and you can have COVID-19 and be asymptomatic. As many as 25% of people tested positive are asymptomatic, and there's probably a larger number of asymptomatic people because you don't get tested necessarily if you don't have symptoms. There are persons who are particularly susceptible and at risk of having most severe symptoms if they catch COVID-19, and those are elderly people, people with pre-existing conditions like diabetes, heart conditions, asthma, or who are otherwise immunocompromised or pregnant. So those people have been advised to be even more cautious and stringent about not catching COVID-19. So original symptoms were cough, shortness of breath or difficulty breathing, and fever. They've added to that list chills, muscle pain, sore throat, a new loss of taste or smell, and then the CDC is also saying this is not a list of all possible symptoms. Less common symptoms include gastrointestinal symptoms like nausea, vomiting, and diarrhea. Again, CDC updates this list several times, so be sure to stay up to date with the most recent CDC information. COVID-19 transmitted person to person is the most common. That's why they're recommending the face masks, etc. But droplets can stay on hard surfaces, and that's why it's the importance to clean regularly and thoroughly. So how do we prevent transmission? What are some best practices to implement? And this is especially important as more people are returning back into offices and work facilities that may have not been working during some of the shutdowns or may have been working from home. First thing you want to do is practice physical distancing. And the first couple slides we have here are like individual recommendations, and then we'll get into business recommendations. But you need to share these individual recommendations with your employees through posters, trainings, etc. So physical distancing, a cloth mask or face covering when outside the home, possibly even in the workplace if you're within 6 feet of each other. Avoid touching nose, eyes, and mouth. Wash hands frequently for at least 20 seconds with soap and water. Use hand sanitizer if you can't wash your hands. Cover, cough, or sneeze with a tissue or cough or sneeze into your elbow. And there's actually research that says that coughing or sneezing into your elbow protects other people around you better than the tissue. Less of your spittle and stuff gets through. Clean and disinfect frequently touched objects. Clean your cell phone daily. We're recommending that people not leave their cell phone on desks and things because the cell phones are 10 times dirtier than your public toilets. Kind of scary. Everybody should stay home if they're sick, except to get medical care. And that's not just sick with COVID-19. That's stay home if you're sick. No non-essential travel, no unnecessary shopping and social events. They're starting to rein back these restrictions and say you can do these things if you're taking the proper physical distancing precautions and wearing a mask. We still say schedule meetings via telephone or web conference. And then people need to take care of their health because if you have a weakened immune system from another illness or because you're not getting enough sleep, too much stress, which we all have, I think, with everything going on, then you're immunocompromised and more susceptible to getting COVID-19. So what should people be considering as an employer when they're bringing back employees to the job site that may not have been in for a few weeks or a few months? There are several areas to consider. One of them is how are you going to do the physical distancing? Are you going to provide the personal protective equipment? How do you clean and disinfect? How do you monitor your employees for illness? How do you keep them out of the workplace? Should you? Are there other physical changes you need to make? And do you have to do accommodations for employees at high risk? These are some of the issues to review. Again, one of the most important things that keeps being emphasized by the healthcare professionals and government agencies is physical distancing. So it's important to analyze your work areas, the workflow, and in places where employees might gather and say, okay, what can we do to ensure that in these areas, people are continuing to and are able to physically distance. So are there commonly used rooms such as your break rooms, supply rooms, file rooms, printer areas, etc.? How can you limit or reduce that use? Consider closing off or limiting the break room. If people need in there to use a microwave or a refrigerator, etc., limit the number of people that are in there at one time, or rearrange it so that people are physically distant from each other, at least 6 feet. Supply rooms, file rooms, consider whether one person can be designated to obtain whatever's needed from the supply room and deliver it to another person's desk or other area, so that you don't have multiple people going into your supply rooms, etc. Analyze the routes employees use to get to common locations, and consider whether there are ways to designate routes, maybe one-way hallways, or if you have an open area with desks in the middle, one-way traffic on this side of the desk, opposite-way traffic on the other side of the desk, so that people are keeping more distant. If you have been staggering shifts, consider continue the staggered shifts. If you've been teleworking, consider continuing teleworking, at least part-time, possibly like on reduced schedules. I know that some offices are bringing back half the staff to work these hours and half the staff will be in the office opposite hours, and that way you have fewer people in and can keep them farther apart. If employees cannot maintain a 10 feet physical distance, you should require masks or face coverings. Continue limiting in-person meetings to the extent possible. And then if desks are closer than 6 feet in an open area, are you able to rearrange the work area to increase the distance? Or, like I said, stagger the shifts so that you have empty desks in between people. If you can't do working spaces greater than 6 feet apart, can you add dividers, plexiglass? I started thinking I should have bought stock in plexiglass a couple weeks ago. In public spaces where you have employees who interact with the public, consider plexiglass or other barriers that have a small opening for exchanging anything that needs to be exchanged. But you see that when you go to the grocery store and everything else, they have the dividers up to protect the staff when checking out. Again, one-way paths, we talked about that. Some people are marking distances on the floor with tape so that people are more cognizant of what 6 feet actually looks like. Break room, we already talked about. Consider staggering rest and meal breaks, and that will help limit the number of people that are using a break room. Encourage employees not to take their breaks or meals together, and if you're going to allow it, then require them to maintain that 6 to 10 feet or more physical distance. If you have a water cooler, coffee bar, that sort of thing, consider closing it, and this helps to avoid people gathering there, but it also helps to avoid them sharing items that may be contagious. So consider whether your business is going to allow walk-ins visitors, no visitors, or advance appointments, and that way you limit people coming into the business. Continue to limit non-essential business travel. Consider designating a delivery area where your delivery people drop packages instead of the traditional, we're standing, 2 or 3 feet apart, exchanging package and paper and everything like that. So just consider doing that. Personal protective equipment. So consider for your business, will employees be required to wear face masks or a cloth face covering? You have to make sure that you're complying with your state and local government requirements. Some of them are requiring masks or face coverings for certain businesses and certain customers. Will your customers and visitors be required to wear face coverings? And who provides that? One of the issues earlier on was how to get all of the PPE because there was a shortage. So you have to consider who's doing the providing of those things. And if it is required PPE, you as the employer may be required to provide it. Your cleaning and disinfecting routine. It may feel like we have this down by now, this far into it, but make sure you continue to wipe down high-touch areas throughout the day with a disinfecting cleaner. Do a deeper cleaning at night. Some people are recommending that the cleaning be done visibly within the site of employees and maybe even the visitors and customers, so that they have this confidence that you are taking the proper steps to clean. If possible, provide cleaning spray and or wipes for employees to use on their own and encourage them to continually wipe down their own areas. It helps to provide hand sanitizer for employees and visitors. Prop open doors during high traffic times so that nobody has to touch the doors. And also consider automatic doors or a foot opener. You know, there are products that you can buy that will turn your regular door into an electronic door, basically, so you can prevent having people open it. Another thing you can do is a little less low-tech. If you have knob handles, consider replacing it with a handle that can be pushed with an elbow or hip instead of having to touch the handles. Consider removing soft or porous materials from high-traffic areas, because those are harder to clean and will hold the porous stuff more. And remind employees to continue to practice their individual best practices that we went over earlier. And again, you can do that with toolbox talk, trainings, posters with your employment law posters, and that sort of thing. Telecommuting and work from home arrangements. These are very common right now. There are even some businesses who have announced they are going to allow people to continue to telecommute regardless of what happens with the whole COVID-19. So as we transition back closer to normal, consider allowing employees to continue to work remotely at least part-time. Like I said, that would promote the physical distancing. But make sure that they understand this arrangement is temporary and that they continue to be at will. You shouldn't guarantee anything. We've already had situations where employees who are teleworking want to remain teleworking, and there are certain managers who say, hey, I want these people in the office now where I can see them and monitor them. So make sure you have the written remote working policy or a written remote working agreement signed by the employee that talks about what are the terms of the telecommuting arrangement. How are they going to set up everything? When are they going to return? That sort of thing. So work environment needs to be free from distraction. The employees are at-will employees. They have to comply with company policies, practices, and procedures. They have to take appropriate steps to protect the company's confidential information. Particularly electronically, they need to have secure passwords. And if they're taking physical documents home, they need to be taking steps to protect those. Other areas to address include tracking and reporting of hours worked, the work schedule, any availability requirements, breaks, that sort of thing. If they have company property computers, make sure they have requirements for how to care for those, that those must be returned, they remain company property, etc. Restrictions on caring for others while on the clock. This is one that's kind of difficult right now because the kids' schools are canceled, right? So we all have kids and dogs and other things working from home, but there needs to be somebody who is minding those kids while the employee is working so they can focus on their work. And we'll talk about the Family First Coronavirus Response Act in a second that may provide some exceptions to this. And it's important to monitor your employees and maybe your visitors for illnesses and exclude sick employees from the workplace. Remind employees if they are sick at all, even if it's not COVID-19, if they're sick at all and have worn down their immune systems, they're more susceptible to COVID-19, they should not be in the workplace, they should not be transmitting even the common cold to the coworkers. Require employees to notify the company if they have symptoms of COVID-19, if they have been diagnosed with COVID-19, or if they've had close contact with an individual with COVID-19. You need to know that as the employer so that you can take the appropriate steps and make those decisions knowingly on how you treat those. So If the individual has COVID-19 symptoms, a positive diagnosis, or close contact with someone with COVID-19, you can exclude them from the workplace. We recommend you follow current CDC or state health department guidelines for when to allow the person to return to work. And we used to have a couple slides in here that went through all of that, but they kept changing. And even like the state of Arizona and the CDC guidelines aren't exactly the same because the CDC has updated theirs. State of Arizona, I think, hasn't updated theirs to match. I think they're the ones behind. So your state might have different recommendations than the CDC based on their personal experience and based on your own executive orders, that sort of thing. So guidelines generally still recommend a 14-day isolation if somebody has had close contact with someone with COVID-19. If they have been diagnosed with COVID-19, generally CDC says they need to be fever-free for 72 hours. Any other respiratory symptoms have to have improved, and it's been 10 days from the onset of a positive diagnosis. Now, it used to be 7 days from the onset of a positive diagnosis and 3 days fever-free. Now they're doing that 10 days. So consider posting a sign for visitors. If they're sick and experiencing symptoms of COVID-19 or other illness, they shouldn't enter the premises. They need to call and reschedule or take care of their business by phone. Under current EEOC guidance, you are permitted to take an employee's temperature during the pandemic. So consider whether you want to monitor the employee's temperature. Just understand this does not identify all individuals with COVID-19 because there are asymptomatic individuals, there are individuals with other symptoms but no fever. You can ask employees to take their own temperature, and if it's 100 degrees or higher or whatever you set, then you can tell them not to come to work. Just note that in California, they've said if you're requiring employees to take their own temperature, you have to provide them with a thermometer if they don't have one, and you have to pay for the time that they use taking their own temperature. So make sure you are in compliance with any state laws that relate to that. The 100 degrees is kind of arbitrary. CDC used to say a fever was 100.4 or higher. They are no longer listing the 100.4 with their symptoms. They're just saying if you have a fever. So really helpful, I know. With or without monitoring the employee's temperature, you can ask employees or visitors to fill out a form or to answer questions relating whether they have symptoms or if they've been exposed or had a high risk of exposure. And slide 44 has some of these questions. First, do you have symptoms of COVID-19, coughing, shortness of breath, difficulty breathing, fever, chills, headache, sore throat, loss of taste or smell? We didn't add the gastrointestinal on here because that's been so rarely reported, but you could consider that and then add additional symptoms as the CDC adds them. You can ask them if they've had close contact with anyone with a confirmed diagnosis of COVID-19 within the last 14 days, or whether they've traveled to a foreign country or U.S. location where there's a high number of COVID-19 cases. And you can, if they answer yes to those, then exclude them from the workplace. We get this question a lot now that people are starting to come back to work. Can we test our employees for COVID-19? So under the Americans with Disabilities Act, typically you can only do medical exams, which a COVID-19 test would be a medical exam, if it is job-related and consistent with business necessity. So on April 23rd, the EEOC issued an updated guidance saying that testing is permitted, it's job-related and consistent with business necessity because it presents a direct threat to the health of others. So you can test for COVID-19, but the EEOC said you must use tests that are accurate and reliable. So you can't just go on a website and say COVID-19 tests and then use them. There's a lot of tests that have a high number of false negatives. So you have to be careful if you decide to offer testing. What we're recommending if you want to do testing and what a lot of our clients are doing is using a third-party nursing service, medical service that conducts those tests and is responsible for the testing so that you don't have to worry about some of the requirements. Okay, accommodations for high-risk individuals. So what if you have an employee who has really bad asthma or has diabetes or is 68 years old and high risk. All of these people have been told by the CDC that they should limit their interaction with the public to the greatest extent possible. Some people say, can I refuse to let them come back to work? I'll keep them teleworking. I don't want them here where they might risk getting sick. Generally, you cannot exclude the employee from the workplace simply because they are in one of these CDC high-risk groups. You can do an individualized assessment to determine if the employee would create a high risk of harm to themselves by being in the workplace. And the individualized assessment would look at where do they work, what kind of conditions, how much contact do they have with other people, etc. You have to, if requested, provide a reasonable accommodation and have that interactive ADA dialogue with employees whose medical conditions put them at high risk. And you have to provide that accommodation unless doing so would place an undue burden on you as the employer. So you have to go through that whole ADA process. You can ask questions or seek medical documentation to substantiate the disability, the high risk. And they can be excluded from work if the condition poses a direct threat and there's no reasonable accommodation that would eliminate or reduce the risk. So if somebody has one of those conditions and you don't want them coming to work, you have to go through the whole ADA process and make that determination that you as the employer cannot do anything to reduce that risk. EEOC has suggested that some accommodations to reduce the risk would be PPE, removing non-essential job functions, like if you have somebody who 80% of their task is office work and about 10% of the time they're interacting with the public, etc., and interacting with the public is not an essential function of that position, you can remove that as non-essential job function. EEOC recommends creating additional space or installing physical barriers, rearranging physical workspaces, or relocating the employee to a different work area, or modifying their work schedule to reduce contact with other people. And that can be reducing contact in the office or on their commute to work. Like say it's somebody who has to ride a bus, the buses are busier during certain commute hours, less so on other hours, adjust their schedule. And teleworking may be a reasonable accommodation if you and the employee agree that's what they want to do. Okay, Family First Coronavirus Response Act. This law was one of the first laws passed in response to the pandemic. It became effective April 1st. The key provisions for the leave became effective April 1st and expired December 31st. There were 2 leaves provided, and these apply only to employers with fewer than 500 employees, plus most government agencies. The first leave is the Emergency Paid Sick Leave, and the second is the Emergency Family and Medical Leave Expansion Act. Don't confuse these 2 provisions. They have different qualifying reasons, they have different monetary payment requirements, etc. The FFCRA also provided free coronavirus testing, enhanced unemployment benefits, additional funds for Medicaid and nutrition programs, protection for healthcare workers and employees at high-risk places, and some changes to respirator devices for medical professionals. The unemployment benefits under the FFCRA generally allow an employee, if they meet the work history, earnings, and residency requirements, to obtain unemployment without certifying that they're looking for work and without certifying they're available for work if their employer has permanently or temporarily ceased or reduced operations due to COVID-19, if they're not able to work because they're required to be quarantined and they have no paid leave available, if they leave their employment due to a risk of exposure or infection, or to care for a family member who's been infected with COVID-19. And in some states, like in Arizona, if you leave your employment due to risk of exposure or infection, you have to be in one of those high-risk groups. You can't be a perfectly healthy 25-year-old and say, I'm not going to work because I'm afraid of COVID-19 and get unemployment. It also covers other separations related to COVID-19 consistent with the OL guidance, which will be forthcoming. So like I said, the waiting period was waived. The requirement you're seeking and able to work is waived. It's generally not used to calculate your employer contribution rates. But employees who refuse to return to work without good cause may be disqualified from unemployment. And what is good cause for refusing to come back to work will be determined by your local unemployment agency. The Emergency Family and Medical Leave Expansion Act, this provides leave only if an employee is unable to work or telework because of the need for them to take care of a son or daughter under 18 years of age because their school or place of care has been closed or their child care provider is not available due to the public health emergency. So this only applies if the person's been employed with you for 30 days. It requires 12 weeks of leave if the employee is unable to work. The first 2 weeks of this leave can be unpaid. However, you can run it concurrently with the EFMLEA leave that we'll talk about or other paid leave. So the first 2 weeks are paid through a different program, and then the remaining 10 weeks are paid at 2/3 of the employee's regular rate of pay to a maximum of $200 per day with an aggregate capped at $10,000 for the 10-week period. So that's the most you would pay them is the $200 per day. There is a small business exemption that we will talk about in a moment. And there's also healthcare and first responders can be excluded. If you are a healthcare provider, first responder agency, you can make the determination that it would be harmful to allow the workers 12 weeks leave and you wouldn't be able to provide continued services, et cetera. The employee who's taking the leave must provide a certification that there is no other person taking care of the child. So leave is available under the regulations only if the person is actually needed to and is actually providing care for the child. So it's not a, hey, I get 12 weeks paid to go spend time with my family, because if your husband was laid off and he's at home and available to take care of the child, you don't qualify for the leave, etc. After the EFMLEA, you have to return the person to the same or equivalent position, just like with regular FMLA, except if the company has fewer than 25 employees and the position no longer exists because of economic changes. So yeah, important to point out here, this expanded Family Medical Leave Act applies to any employer under 500, including those under 50 who don't do the rest of the FMLA programs. So if you're under 50, you're not covered by regular FMLA, but you still are going to be covered by this EFMLEA. Emergency Paid Sick Leave Act. This requires employers, it says covered employees, covered employers to provide up to 80 hours of paid leave, and that's prorated for part-time employees to 2 weeks. So basically 2 weeks. If the employee is subject to a federal, state, or local quarantine or isolation order, if the employee has been advised by a healthcare provider to self-quarantine due to COVID-19, if the employee is experiencing symptoms of COVID-19 and seeking diagnosis, so they have to actually be seeking diagnosis for their condition. If the employee is caring for an individual subject to orders 1 or 2 above, if the employee is caring for a son or daughter whose school or place of care is been closed or the child care provider is unavailable due to COVID-19, or number 6, catch-all, the employee is experiencing substantially similar conditions specified by the Secretary of Health and Human Services. Number 6 hasn't been specified with anything yet, so really you just have to worry about numbers 1 through 5. One thing to note is that the Department of Labor did issue regulations that said a federal, state, or local quarantine or isolation order is a government order or includes the government shutdown orders. So if for some reason the employee could not work because the government shut down, but you had a work available for them and you were still open, then they would be covered by this sick leave. However, if the business shut down because the government shut down, there was no work available, then they wouldn't be covered by the leave, because the reason for the absence wasn't the shutdown order. Well, the reason for the absence was the shutdown order, but basically there was no work available to them to do, so they're not entitled to paid leave for that time period. The leave must be provided in addition to whatever leave you already provided. if the leave relates to the employee's own diagnosis, exposure, or treatment, their own self-quarantine, etc., they have to be paid their regular rate of pay up to $511 per day and a maximum of $5,110 in that 2-week period. If the leave relates to care for a family member because the family member has been diagnosed or because this family member is quarantining, then they are paid at 2/3 of their regular rate, capped at $200 per day and $2,000 in the aggregate for the 2-week period. So they don't get to stack this leave and compound it. They only get 2 weeks total for whatever covered reason. So if they use 4 days because they have their own symptoms and they get a diagnosis and the doctor says it's not COVID-19, go back to work, and then a week later they ask for leave to care for a child, they only have 6 days left because they've already used 4 days of that leave. So they don't get to stack it, and you're limited on what you pay them and what you return. You have to pay for the leave, but you do get tax credits that we'll be going over. You must post notices to the employee, and the DOL has issued posters to satisfy that requirement. And if you have 500 or more employees, you're not covered by the law. But remember, you still have to comply with other existing laws, such as the general FFMLEA requirements for a serious medical condition. So if you have an employee who has COVID-19 or who has a family member with COVID-19, they may qualify for regular FFMLEA leave as well. Intermittent leave is permitted under the Family Medical Leave Expansion Act if agreed by the employee and employer. It's permitted under the Emergency Paid Sick Leave Act if the leave is to care for a child whose school or place of care is closed or care provider is unavailable. And it's permitted under the other reasons for leave only if the employee is teleworking. So if you say, I need leave because I have COVID-19 symptoms, you're not going to be allowed to come intermittently into the workplace. It's all or nothing on those type things. Small business exemption, if you have fewer than 50 employees, you can declare yourself exempt from the EFMLEA and the EPLSA, but you'll be subject to audit and redetermination by the Department of Labor. You have to, in making claims for the exemption, have to make a determination on 3 factors, whether you're actually going to qualify for that exemption. And that can be that, well, the 3 of them are there. The provision of the paid sick leave or expanded medical leave would result in the business expenses and financial obligations exceeding your business revenue and cause you to cease operating. The absence of the employee or employees requesting paid sick leave would entail substantial risk to the financial, health, or operational capabilities of the small business, or there's not sufficient workers who are able, willing, and qualified to meet the labor needs of the business. You should keep written records of how you made the determination. Keep financial statements, employee information, contracts, job orders, anything that shows the financial situation and justification for qualifying yourself as exempt. The tax credits, 100% refundable tax credit for wages up to the max limits. If the company can pay more than what is required, but you are limited to collecting only what is required. So you don't have to pay more than the $200 a day or $511 a day, but you can, but it's not recoverable in the tax share. The tax credit also includes an allocable portion of the healthcare premiums and the employer share of Medicare tax on the payments made under the program. So how do you take the tax credit? Well, here's the limits. We already talked about the limits. You take this against the employer's portion of your Social Security taxes. That's where the credit is applied. However, it says under IRS guidance, you can retain amounts from your federal income taxes, employee share of Social Security and Medicare taxes, and employer share of Social Security and Medicare taxes, even though at the end of the day, the credit's only against your Social Security tax obligation. So when you file your taxes, let's say you paid out $5,000 in sick leave, you have $8,000 in payroll taxes due, you would send $3,000 to the government, and then you would also send the justification for withholding $5,000. If you pay $10,000 in sick leave and your deposit is $8,000 in taxes, you can file a credit request with the IRS to get that other $2,000 back now instead of in the future. You claim the tax credit on the Form 941. There's a Form 7200 to ask for advance payment. And if you're using a PEO or third-party payer, you are entitled to the credit, not the third party. The FFCRA tax credit cannot be considered payroll under the PPP. So if you're taking a tax credit for this payment, you can't count it as part of your payroll under the PPP. IRS requires statements from the employee to substantiate the need for leave. So when you have an employee who's going to take the leave, make sure that you have an application form or a certification form for them that includes their name, the dates of the leave, the qualified reason for leave, and supporting written documents, a statement the employee is unable to work or telework, and then depending on the reason for leave, they're going to have to identify the government order, the doctor's order, the school care provider that's closed, and that sort of information. Because there's different tax credits for different types of leave, make sure that you maintain these in a manner that allows the company to easily identify the use of leave. So you can do COVID self, COVID other, COVID child, some sort of designation like that. So we have a couple more topics to go over in the next few minutes. Julie is going to take us through OSHA guidance on preparing workplaces, pandemic preparedness and response plans, etc. Julie, you there?
So
thank you.
You bet. You can change it back over to me and I'll take over.
There you go.
Thank you, Heidi. There's a lot of great things there. So we'll do a change the presenter on that one. And when I see that pop up, take that. Heidi, we've had a lot of great questions. It's awesome. So we will go through a number of items. And I think we're now at PowerPoint. Where are we at? We're at 71. Quite a few here. Yeah, 71. There we go. I'm just popping it up right now to make sure we got the right one. Okay, so a couple of things on the questions. Heidi, again, is going to try to answer them, and we will definitely go through all of those and address them. One of them was on the sanitizer. Should you have it on the outside of your workplace? Sanitizers are a good idea. The only thing you have to be careful of is how to deal with the touch point, the high touch point on it. So sometimes the ones you can put your hand under and they automatically dispense is a better choice than the ones that actually you have to touch the button on. So keep that in mind too. The other thing that came up that was a really good question earlier was, what about 403B retirement savings? I really believe, at this point, we haven't gotten more guidance yet. We believe that all the benefits should be covered. So again, that would be in your substantiation memo to calculate that as part of your compensation program. And for individual questions, again, just send us emails and we can try to respond if you need more specifics on that. But generally, the idea was to include those items in the way the guidance has been given so far. Again, we're waiting for another round of guidance, but so far. And someone had a question about conducting a layoff. So Anna's summarizing those questions to get to us as quickly as we can, and Heidi will try to respond to those, some of them in writing, so they'll pop up on to everyone. But, when you're doing a layoff or a furlough, remember the differences. If you're a layoff, that means the person's supposed to go look for a job, and they are not employed by the company, so they get no further contact. They can collect unemployment under the rules that went into place through the end of July. And that way you can recall them when you want to, if you want to. And one of the things that you can think about is a furlough. A furlough keeps them on your payroll. That means they get their benefits and you'd be paying those items. And also that under a furlough, they are still considered employees. You can bring them back anytime. And that way you have that option, and they can collect unemployment while they're on furlough, and then you can recall them if you do. Once you recall them, as Heidi was explaining, the Families First Act, they do qualify if you recall them even for a day or part-time for those two, the EFSLA and FFMLEA leave. So keep that in mind. If you put them into work even part-time, they do get to qualify for that, and then you have to budget for that if that occurs. I'm trying to see if there was any other questions that I didn't miss. Yes, the unemployment, again, you do turn it in. you can't do PPP monies for credits at the same time. That was a good question. All right, and I'll let Heidi look through some of those while I'm going through the other PowerPoints. We did do very good PowerPoints, we think, to help you to refer to them. That's one of the benefits and the added value today. We tend to be very proactive and education-oriented, which is why we do the books with wonderful HR symbol and the chambers. That's a good resource guide for everybody to avoid problems. Well, let's cover a few more things. First, the HR, or the OSHA, I mean. So I do a lot of OSHA work. It's our national niche, and OSHA is important too, and OSHA has come out with their guidance. So as Heidi said, we have different federal government agencies coming up with different requirements. So keep in mind, you have to know whether you're under the DOL bucket, whether you're under the EEOC bucket, whether you're under the OSHA bucket, whether you're under the IRS bucket, your state unemployment agency, and then don't forget we have workers' comp to consider. Those are some of the buckets that you have to manage in your risk management analysis. OSHA is one of them. They do want to make sure that each company has a pandemic response plan. We've been drafting a lot of those. They're different for construction versus different for office employees versus different for other industries. So again, OSHA likes under the general duty clause to remind employers to make sure they've recognized hazards, do a job hazard analysis, and make sure they've thought about the task being done. And really, in this case, it's a little bit counterintuitive, but the issue is usually we're always concerned about safety out in the field, right, for production work and everything. But COVID-19 and the pandemic, right, is more office and people in close quarters. So sometimes you have to do more training of that because your office workers are not used to that. So keep that in mind too. So it's something a little bit different than what you're used to. Obviously, the higher level of risk, the greater the need for precautions. As we said, you can stage people differently at the time clock, or you can do applications or things like that. The infectious preparedness and response plan is important. And this is where we put in those protocols of how you deal with some of those issues and best practices that Heidi reviewed. It helps your whole team be able to follow that document and know how to deal with it and have a system in place for communication. Mainly, OSHA recommendations follow mostly what we already have covered for suggestions from Heidi and I, and also from best practices from the CDC and things that we've suggested beyond that. One extra one they remind us is provide trash receptacles that are open to toss items into to minimize the number of people touching the documents. And again, we've talked about the telecommuting, staggered shifts, make sure you have a policy, those kind of things. And again, OSHA would say you definitely have, as a employer, the right to require people to wear personal protective equipment, or what we call PPE, and define that as you can. A lot of people I know in the field are wearing bandanas and dust covers. The N95 masks are pretty tough. You have to use it for respirator work that's required under the OSHA rules. But for others, some people find that the N95 mask in particular, if you have respiratory issues, coughing, asthma, things like that, even if it's unrelated to COVID-19, they do cause you to have more restricted airflow and are more difficult for some people to wear. So it's not like everyone can go out and say you must wear an N95 in other businesses, and this is not including healthcare workers or first responders. Different issue. But for everyone else, just saying I want everyone to require an N95 may not work, and it can cause people that have COVID or asthma or respiratory issues problems because it reduces the oxygen in and it makes it more difficult. Make sure your hazard communication, remember the SDS sheets we always remind you about in your policies. You are required to have those available, whether you use an electronic SDS program or a paper program, you must have those, so keep that in mind. All right, other things. A part of the overall safety plan, here's some topics to include. We like to do toolbox talks. We're big on safety training. So we like to see a toolbox talk that's done for office workers, which they're not used to getting, and it's important. And then separate ones for the field. The field is actually the easiest to teach practices and work through those issues because they're so used to so many safety OSHA rules. I find that they will follow what you teach them, get in the habits of them very quickly, and easier to teach. Your office people, they're just not used to that. It probably requires more training, more monitoring, and more help. So keep that in mind. And you do want to have in your plan the procedures for cleaning and disinfecting. We've had to arrange for a lot of disinfecting of company sites. And that's important to have built into your program with a local provider who can come in and clean an office so you can get back to work in 24 hours if there is a positive test in one of your areas or in the field that's roped off. To be recordable, what does that mean on the OSHA 300 log? There are things that have to be recorded if it's a confirmed case of COVID-19. Some states, remember, you have federal OSHA program that covers, and then some states have individual state plans. So stay attuned to your state program on what they require. California has taken a different approach on some of these observations, so just keep that in mind. But generally, it has to be a work-related factor to record it. It involves one or more of the general recordable requirements, and only right now healthcare, first responder, and correctional institutions have to report if someone tests positive, but you may have other circumstances that require it. So keep that in mind, such as if you send people down to build the fence at the border and they're living in close conditions that the employer has provided, they may all count, and you need to include that if they haven't been anywhere else. And key is, are they wearing their protective equipment around each other? If they're driving in a vehicle, are they wearing dust masks, using gloves, things like that? We've had a lot of employers now create spreadsheets and are keeping track of those things. What about working from home with all this remote work? Are they going to come and visit? No, OSHA doesn't plan to come and visit, but you do have to make sure, as we mentioned, the telecommuting agreement covers provisions to protect you. So you are required to have certain provisions, and you need to make sure those are in your agreement. We like to either see a policy for telecommuting and or a written agreement to allow people to work from home. So remember that you have to think about these as issue spotting items if people work remotely. We do, again, no retaliation against people who raise concerns, and we don't want to see a lot of complaints rise because people think they got fired for raising a concern about COVID, although that's all everybody talks about right now. So COVID is very prevalent in discussions. Just make sure, again, you have legitimate non-discriminatory reasons for what you do. Protocols for positive COVID-19. Obviously, you close and clean the disinfected site. This is on PowerPoint 79. Communications with employee who has COVID-19 and returning to work. Current guidance varies depending on whether the employee tested positive or did not, and whether they had symptoms or no symptoms. There are different steps to take. What do you do to communicate with other employees? We have a different series of letters. We have one that goes to those with close contact with the employee, worked very closely or rode in vehicles with them. And then we have a letter for other people who weren't so close with that employee, didn't work around them, to monitor the situation. Let's see, communications with third parties. You do have to think about that, about owners and about vendors and others that you may need to communicate with. They may be communicating to you, you may be communicating to them. In construction, we're dealing with this regularly, where the general contractor may be communicating with the sub, or the sub, vice versa, is communicating with the general. So there's other companies on your site that you may need to communicate to. Here's another consideration we like to remind you, is how do you deal with new hires in the office and your application process and your interview process, and how about your safety orientation if you have that? So you have to think a little bit differently. Remember, we're about 18 months into this going forward process. So you want to think about interactions with them. How do you give them the forms? Can you complete things by DocuSign or other programs, Adobe Sign, whatever's out there? Consider whether orientation can be done electronically. You have a lot of programs today, whether it's GoTo or Zoom or other things, WebEx. You can use a variety of things to communicate. Do you put the paperwork for new hire paperwork after they've been hired in a box and let them retrieve it? Do you have different pens you set out there for them to use? Do they get cleaned in between? Do you need to wear dust masks and gloves? This is really hard for HR, payroll, and safety. We're used to being one-on-one in front of people and talking to them and looking them in the eye. And now we're telling them be careful and maybe don't do that. So you want to think about how can you still connect, have communications, not face each other as much, and figure out ways to minimize risk. Remember, we can't eliminate all the risk, but how do we minimize risk? A lot of people are thinking about plexiglass dividers between the HR personnel and applicants and new hires. How about having individuals complete paperwork at a desk? If you have good weather, they can sit outside and do it. We've had a lot of people switch to that. Some areas are getting too hot and they can't. In the winter, it's too cold. You have to figure out alternatives and make sure you're cleaning the areas between things. All right. Now, a couple of other suggestions. Let's go through a couple scenarios. We thought a couple of these might be helpful to you. And Heidi's answering questions as fast as she can on the chat room, and so did I, so you'll see some of those. All right, let's take the first one. Let's say Joe is a tile installer. He comes to work on Monday coughing, and a little flushed. His coworkers are expressing concerns over working with him, and they say, hey, I don't want to work with him. He's sick. I'm not sure what to do. What can you do? Can the company send him home based on his cough? The CDC guidance, Center for Disease and Control, states that employees showing signs of COVID-19 should not come to work, and they can leave the workplace, and so you can have them do that. And the EEOC, the Equal Employment Opportunity Commission, has stated that during a pandemic, employers have the right to require employees who are showing symptoms of COVID-19 or the flu, because let's not forget, the flu is still a very devastating disease in society and kills many people every year, why it's important to get the flu shot, to stay away from the workforce, so you can have them do that. So this is going to cause everybody to rethink whether they've had measles shots and gotten their kids measles shots in their own family, because that is so contagious and has such strong consequences and potential death. You know, in the realm of contagibility, you know, how it's more contagious, I guess, you have the flu, which is not as contagious as COVID-19, which is more contagious than the flu, but measles are much more contagious. So in the realm of those three orders, it goes about like that. Can the company take Joe's temperature if employees are saying, hey, this guy's coughing, I'm more afraid to work with him? Can you take his temperature? The Americans with Disabilities Act typically restricts medical exams to those that are job-related and consistent with business necessity, or the reasonable belief that the employee poses a direct threat to the health or safety of the individuals. Based on the designation of COVID-19 as a pandemic, it is likely that the EEOC would consider the pandemic a direct threat that allows a medical examination, such as taking temperatures. Remember, though, that some people are asymptomatic and can be positive without a fever or other symptoms. That's been the real big problem, right? And we've seen this virus is morphing in different ways. So a temperature is not the only thing that is going to solve the issue of whether people are able to work or not have the COVID to spread. What about asking Joe if he has any symptoms of COVID-19 or if he's been exposed or infected? You know, in the past, under the ADA, you can only ask whether the person can do their job with or without a reasonable accommodation. And that's it. And then you have an interactive dialogue about the accommodation request, and you move forward. This is a little different, and the EEOC, because it's a pandemic, is allowing you to ask other questions. So the employers can and should require that employees, if they have symptoms of COVID or have been exposed to someone with COVID, meaning they're taking care of someone in their household or maybe just exposed or have contracted it, can ask questions. You do not have to wait till someone shows sign of an illness either, so that's a big change. You can require all employees to affirmatively answer questions each day before they start work or arrive at a site. And you can instruct employees not to come to work and inform them by telephone if there's an issue. And we went through some of those questions you can ask, and many of our companies are asking those questions, or at least on job sites or other locations and big facilities, they're making people answer those each day. All right, scenario number 2. Let's learn from scenarios. Sam is a member of a 6-person crew, and last week they all worked together on a project. He was not showing any symptoms of COVID-19, flu, or any illness, because remember, it's any illness we care about. It doesn't even matter if it's just COVID. So then what happens? All the crew went directly from their homes to the job site. They didn't go to the office. They didn't interact with other crews. On Monday, they ended on Friday. So on Monday, Sam calls and says he's tested positive for COVID-19. So we're having this reoccurrence all the time in how to deal with this. It's going to become pretty routine on how to deal with this. What can the company do regarding Sam? What can the company do regarding the other 5 people who worked with Sam and who may have been exposed? All right, let's talk about that. The company can and should require the employee to stay out of the workplace if they're positive for COVID-19. The employee with COVID-19 symptoms should not return to work until after they're cleared pursuant to those guidelines we went over. You can require a medical certification from an employee about the COVID-19, but if it's in an area that's very busy with healthcare providers, you may not be able to get the clearance in the same way you did in the past. So you just need to be flexible about that. But some people can get it through telemed, so you still can go through your normal procedures. Now, the current CDC guidelines for individuals with COVID, remember, if it's tested positive, if someone did test positive, they have 72 hours must pass once the fever is resolved without the use of medication, and that there's an improvement in respiratory symptoms, and 10 days have passed since the symptoms first appeared. They've changed that again. It keeps changing. We've changed this slide, I think, 5 times since we started all this. But now it's 72 hours have passed without the use of medication and no symptoms, and then 10 days passed since the symptoms first appeared, first onset. The fever has resolved without the use of medication, and the respiratory symptoms have improved, and there's 2 negative molecular assay tests at least 24 hours apart. And that's because the tests, you've seen so many people test negative, then positive. So they're trying to do more testing on those things and follow up. Confirm positive with no symptoms. At least 10 days have passed since the first COVID-19 test and no symptoms have appeared. So again, this is a brand new change. Or confirm positive with no symptoms and at least 2 negative molecular assay tests at least 24 hours apart. Now, the individual exposed due to close contact with the positive person, the general recommendation is 14 days of self-isolation still, but it can be different recommendations can be applied to essential infrastructure workers. So you have to use some judgment about that and what your positions are and what you're working on. The company should notify the coworkers of the potential exposure. How do we do that? So we have a series of letters. Again, we think that's a good idea. A difference between close contact we mentioned versus no close contact. If they had close contact, working together closely in a vehicle, things like that, being in a hotel together because they're doing remote work or something, then it would be 14 days removed from the workforce. And again, those may qualify under the FFCRA rules that we talked about earlier. Company must not identify which employee has been exposed or diagnosed. Don't forget, you don't just go randomly go tell the world and broadcast it. The person has certain privacy rights under the ADA and HIPAA, and you can ask for consent to disclose the identity. But mainly, there's a letter we give the employee and suggest them to take steps, and they often will go tell people so that they can go take the appropriate responsible steps about that. Now, what are these 14-day exposures and what are things you can do? Again, for those who've been exposed but don't necessarily have the symptoms, but they have close contact, the CDC provides some guidance, and PowerPoint 89 goes through those. Measure employee's temperature, assess for symptoms, require the employee to self-monitor, require them to wear a face mask after they get back to work, require physical distancing, no sharing of headsets, equipment, things like that as best you can. Clean and disinfect the employee's work areas. Send the person home immediately if showing symptoms, and treat all employees who've had close contact as though they've been exposed. You want to clean and disinfect areas where people worked if they test positive. We suggest on PowerPoint 90 some of those steps to utilize. Consider hiring a professional company that will and you should close the area for 24 hours. If there's windows and doors, open them, they say. Get the air in there. Sanitize and disinfect the areas using CDC recommended cleaning disinfecting solutions. Clean all hard surface, mop solid surface floors, fog AC returns with disinfectant. Clean carpets using cleaning solution and disinfectant, fog all rooms, wipe down high-touch areas. So those are things that are happening all the time right now. And you should also talk to your cleaning crew about how they're cleaning spaces and if you don't want them to touch keyboards and things like that to minimize germs and exposure. What are some potential action items for businesses? How do we wrap some of these things up to help you think about your checklist? So PowerPoint 91 starts that list just as a kind of a summary and reminder. I know we've covered a lot of information today. And again, Heidi's answering as many as we can, and I have been as fast as we can. We know there's a lot of questions and issues in this area, and things still do change. So stay tuned for the laws and regulations and interpretation. Use a written telecommuting policy or agreement. Implement COVID-19 prevention, preparedness, and response plans so you comply with OSHA and you have that available. That helps all of your team be able to refer to that document and evaluate and make decisions. Draft employee communications regarding your plan. Teach people with toolbox talks. Your field is different than your office. Prepare a temporary leave policy, as we mentioned to you. We do those, you can do those, but don't put it necessarily in your handbook because it's going to expire on December 30th, or it may be extended a little bit, we'll see, but that's not going to be a permanent policy. It's a temporary policy. So a policy with the application process, how they apply for things, there are certification requirements, as we mentioned, they must complete. Those are important. Update your OSHA safety plans. Always have actually an emergency response plan anyway. And note your 300 log procedures for those that have to complete those. Remember how to do those, to update those, that kind of thing. And don't forget, with everybody working remotely, we're having huge increases in hacking and spoofing and phishing and all kinds of things, and trying to get wiretaps and things like that for transfer of money. I mean wiretaps, but wire transfers. Update your security plans for physical and electronic security. Watch out for those ransomware. It's been a huge increase. Chaos is in the cyber networks, believe me. So watch out for that. Have a check on that. There's companies that do that. They can close the ways that people can get in, and they can give you good ideas for monitoring. We talked about the furloughs and layoffs and reduction in forces. And if you don't forget, there's something called the WARN Act. And if you have over 100 employees and you don't bring those employees back within a certain period of time, and you laid off a large number or closed a facility, you do have to evaluate whether you may have to give certain notices or have a 60-day notice requirement and payment to them. So be careful about that and whether what is happening in your area meets one of the exceptions. So we'll see about that. Determine whether positions can be revised to keep people employed. So sometimes you can just right size, change it, change job duties, things like that. Consider staggered shifts or staggered days to reduce the number of people working in the location so they have greater distance from each other. Maybe you need to have counseling for stress and other things for the mental health. If you've got a lot of people working remotely, you've got to stay motivated. Travel letters for essential industry workers. We've had to do those throughout the country at different time periods so that people are carrying that. We had police and others stopping people when it was appropriate for them to actually be on the road. So sometimes we do a travel letter package to help people. Evaluate your application of workers' compensation. Work with your carrier for tips and record-keeping requirement up front. It's a good idea to get some of that information up front. Consider providing information to employees to apply for unemployment. Again, it shouldn't be used to calculate or assess against your rating. Again, if you're a nonprofit, we may need to look a little deeper on your self-pay or a church. But generally, it doesn't apply, and you do have to have a certain response. We have a draft response we like people to send, so it's clear it's COVID-19 related, and that you do not have to be charged to your account. Also, remember that if you're trying to get people back to work and they won't go to work, we suggest a standard letter that indicates, I know we started sending these out that indicate that you've offered a position, you understand they're not going to take it right now. We encourage them to reapply when they're willing to return to work, but they're basically they want to just stay and collect the money and then go back to work. So when that happens, they're saying that that doesn't count against your 75% necessarily, but please seek legal counsel and double check that for your own companies. And again, improvise, adapt, and overcome, and be flexible because we know these are changing regularly and this makes it a little bit challenging. If you need help with some of these documents or products, you know, we're doing those regularly for people. You can do them yourself. We've given you all the tools, but some people like to outsource it and just get it done, and, you know, we can do that as well. So this gives you a list on 9495 of the kind of things that we've been doing for people. The big one I will highlight on PowerPoint 95 is the PPP substantiation memo. Super important to do, and we think that's a very highly recommended package to put together that can be used with your bankers, accountants, and any SIGPER audits. And the letter to return funds, we have a cover letter to go with those things if you feel that you need to by the 14th or even after that. Other things, just remember your breach of contracts, landlord-tenant issues. These are all things on PowerPoint 96 coming up. You know, what's happening with the travel letter, the changing government orders, construction contracts, do you need to update them? How do you want to do your force majeure provisions in the future? What do you want to negotiate with your brokers? Things like that. So just remember there's lots of things to think about here. Anyway, we'll wrap up with that. We've covered a lot of information. Hopefully we covered most of it. One tip I will give you at the end, please make sure that people are accurately recording their time entries and hours worked for wage and hour compliance. Department of Labor will be auditing things as always, and so we don't want to have problems there. So do the best you can with that. Again, you can ask questions, but this has been a great opportunity. I hope to get out a lot of information. These PowerPoints are available. Anna will get them out from HR Simple. The books that you utilize are being updated. I know we're rolling out a new one in the West for people to use with communicable diseases and how COVID-19 and some of these OSHA rules play out. So watch for that rollout and stay tuned. And I'll turn it back over to Anna. I know we're answering questions as fast as we can online. But Anna, take it from here. Again, on behalf of Julie Pace with Gamage and Burnham and Heidi Nunn-Gilman, my partner, thank you for being proactive. Thank you for monitoring and managing and getting your businesses back to work and the ebb and flow of what's happening with this COVID-19. So thank you. And Anna, we'll turn it back to you. And thank you to everybody today.
Thank you again, Heidi and Julie, for that great webinar. We got some really great information today and actually answered all questions. If you have any additional questions, please feel free to email me at anna@hrsimple.com. That's up on the screen, and I'll be able to forward those. And as a thank you for attending today's webinar, we are extending the 30% discount off all HR Simple products with code RISKMANAGEMENT30, and that does include the Employment Verification Guide, which Heidi and Julie both authored. Thank you so much, everyone. Stay safe and have a wonderful day.